All right, we have Dr. Nitya Mani, MD. She's a board certified child and adolescent psychiatrist at UT Health Austin Pediatric Psychiatry at Dell Children's. She specializes in integrated care. Additionally, Dr. Mani is an assistant professor in the Dell Medical School Department of Psychiatry and Behavioral Sciences. Dr. Mani is the associate director of the Child Psychiatry Telemedicine Program at Dell Children's Medical Center. Her clinical interests are providing comprehensive, compassionate care for children and their families through outpatient work and collaborative care models. It's fabulous. Just up the alley of CFAN, right? And then we have Dr. Pooja Patel. Dr. Patel is a PhD, and she is an assistant professor in the Department of Psychiatry and Behavioral Sciences and an assistant director of the Child Psychiatry Telemedicine Program. She specializes in cognitive behavioral therapy with youths dealing with anxiety and depression, as well as in medical coping of adjustment to chronic illness, pain management, and an adherence to ongoing medical regimes. As part of the clinical faculty, oh goodness. Dr. Patel is also involved in the training program, which includes teaching and supervising future clinicians. So thank you both so much for joining us today. And we can't wait to hear what you have to share with us. Take it away.
Great, thank you so much. So it's really, really exciting to be here today virtually and to speak with all of you. Like Dr. Martin said, my name is Nitya Mani. I'm a child psychiatrist, and I have Pooja Patel, who's a pediatric psychologist, here with us today. And we wanted to talk about the management of pediatric mental health concerns across school and primary care settings. We've aptly named it Schooling PCPs. I'm really excited that there's so many different types of providers here today. And so this talk is really geared towards PCPs, but I think a lot of the things we'll talk about are applicable to many different disciplines. I know that we have some school ISD people as well, and really appreciate you being here. I think when we talk about some of the school processes, you would probably have way more detail than we're gonna go into today, but I really welcome you and appreciate that you're here. So the goal of our talk today is to explain the types of mental health accommodations available within the school setting for different diagnoses. We also want to talk about the different types of school-based interventions for specific diagnoses. And lastly, specific ways that PCPs can coordinate with school staff to care with students with mental health issues. And so as we all know, the mental health of children is a really important topic. And we know that mental illness within children is very prevalent. So the kind of most staggering statistic is 1 in 5 children from ages 0 to 11 experience a mental disorder within a given year. Additionally, 10% of those kids are having some impairment in their daily functioning at school or at home and in the community. So it's really affecting how these kids are functioning and affecting their well-being. And as all of you know, being in the field, it really is a ripple effect. So it really affects kind of their life overall. And here's just some statistics about the commonly diagnosed mental disorders. So ADHD, behavioral problems, depression, and anxiety. We will talk a little bit about the accommodations for those, but just to put this up here, just to kind of remind ourselves of the prevalence of these illnesses. And so one of our goals and one of the reasons we wanted to put this talk together is for children. They really have 2 broad safety nets, and they're public institutions that really buffer the effect, the length, and the severity of childhood adversity and trauma. And those 2 safety nets are schools and their PCPs. And so schools are somewhere where children are required to be almost every single day. They have a lot of contact with trained professionals there. And similarly, a lot of kids are seeing PCPs or some sort of primary care provider fairly often. So these are 2 places that have a lot of contact with these students and essentially the general population, so all of the students. And so it's really a great safety net to help manage the mental health care of these children. And so we wanted to put the 2 together and really think how we can tighten up that safety net so the 2 are collaborating.
So as part of our talk, we wanted to kind of just go over, especially in the primary care setting, you're thinking this child needs accommodations or needs help. So we just want to go over kind of the school speak and what that looks like. And there are two main ways that kids get accommodations in schools, and one of which is a 504 plan, and that is actually embedded within Section 504 of the Rehabilitation Act. And it's a civil rights law, and it prevents discrimination. It's not just limited to kids. And it protects all people who have physical or mental impairment, which is substantially limits one or more major life activity. So for instance, learning in the context of kids in schools, and that there's a record of some impairment. So that's where primary care doctors come in, potentially helping diagnose. And it's causing some sort of impairment in functioning. So there is an impairment that's available. And the goal of the 504 plan is actually to remove barriers and create learning opportunities. When we think about 504s, you're really thinking about adjusting the environment to help the child succeed. So a great example of that would be a kid that is in a wheelchair without any neurological impairment. And a 504 plan would allow for accessible transportation, for back within the school bus, and then within the classroom, and then within the school, making sure that they can accommodate all the places they need to go. Perhaps any sort of like leaving class early so that they can get to their next class. 504 accommodations also target hidden disabilities. So for instance, low vision, poor hearing, heart disease, kids with chronic illness, such as cancer. Conditions like ADHD are very interesting because they can be covered with 504 or also under IEPs or special education. And so in the instance where a 504 plan is appropriate for a kid with ADHD is when they don't necessarily need a change in their educational instruction, but maybe more just support in their environment. And we're going to talk a little bit more about that in our talk. But that brings me to the next category of providing accommodation, which is under the Individuals with Disabilities Education Act, IDEA. And so that's where that IEP plan comes in. And this is a federal education law that was passed back in 1975. And essentially it creates, if you have a diagnosis, it will then ask for you to specify in a category of disability in order to get that accommodation within schools. So there is a specialized need and support. And in this plan and kind of this way, kids are allowed to have individualized instruction and specialized instruction to support their needs. This is just a slide to show the different categories that exist where kids can qualify. And what I wanted to show you and what we wanted to kind of talk about as we go through our talk is just no matter what the accommodations are, the goal of both types of plans is to provide that support for kids. So parents do participate and have to consent to have their child evaluated. There's no cost, these are all free. And it's really meeting the needs of the child. Something to keep in mind is IEP plans and IDEA is federally funded. So it's required for public institutions to implement, whereas 504 plans also are implemented within private education settings as well as public education settings. But we just want you to know that regardless of where students are, and in my experience, schools have been wonderful in accommodating and supporting student needs. And so just in a primary care setting, really helping parents to identify what that is and supporting them to get that need met. So just a general quick overview of what that process looks for qualification of accommodations. And of course, this is just, again, bird's eye view, but whenever there's a need that is noticed, the referral concern, it's recommended that it's put in writing. So, if there's a need, like a learning need, we recommend that parents submit it in writing for the schools so that it's kind of on record and it starts a clock, but then schools can then start the process, the formal process they need to do. And then the screening box is kind of where primary care physicians step in and kind of help and can provide information to support the schools. So that might be by providing data like school medical records or diagnoses or any sort of written documentation that can help the process along. The schools then go in and do their evaluation. Outside information and referrals and evaluations can be helpful, but oftentimes schools want to do they have kind of a formalized process that they're doing as well. And so they will take all of that data and put it together and then use their components that they need to then just come up with the best kind of plan for that student. And so as a team, they will decide with the parents and collaborate to develop what plan is best. So whether that be with an IEP or 504, and then kind of implementing that in real time. And the thing to know about these plans is that they're updated. So IEP plans are generally updated every 3 years. And they also can be sooner than that if there's a need that arises for kids, because we're continuously, things are changing and kids need support. So as we're thinking about schools and school support, schools are an amazing place with lots of resources and support. And so this is just a helpful slide to just talk about, there are a lot of things that are being implemented in schools, and just to bring your attention to that, even though we're going to focus on the top tier of this triangle, school-based prevention and universal interventions for all students. So that can be like social emotional learning. They have different groups and just available to all students. And then there are students that can be identified like through preventative measures that are being targeted with behavioral and emotional concerns. When we look at at-risk students, there's oftentimes supports within schools to provide therapy or meet with counselors to support those students in their mental health needs. And then when we move to the top of this triangle, those are the students that we're really focusing on that you're going to maybe see in your setting at the PCP office or within the community where they have a community therapist, and having that collaboration with the schools to help support the students. And maybe it's that they're being identified in your office and then you guys are bringing it to the attention of the school. Schools oftentimes will know, and then leaning on you to kind of help provide that additional support to help manage their mental health need. So we really feel like this top tier is where there's a lot of collaboration that is possible, that is often already happening, and we just want to bring your attention to it.
So we wanted to talk specifically about the PCP's role in facilitating these school accommodations. So first and foremost, I think the role of a PCP is really to identify the underlying concern to the behavioral problem or the mental health problem that's being discussed by the parent or being brought to you by the school. Conducting different screeners to help really understand what domain the symptomatology is coming from, but also really understanding that this child is in a greater context. So a lot of PCPs have known these children since birth and have a really great understanding of their family life, of their essentially just their community and their environment. And I think that that is something that is a great asset and something that a PCP can really contribute to this process. Secondly, diagnosing the mental health concern. So schools cannot diagnose what the mental health concern is, but you as the PCP can diagnose whether it be MDD, whether it be an anxiety disorder, ADHD, or something else. You can make that diagnosis and provide the documentation to the school in order to help facilitate getting those accommodations or help with the 504 and IEP meetings, because that information is really important for them for the schools to get a sense of what the next best steps are. The next part, and this is one that I think PCPs don't always do, is actually recommend accommodations. There are things that you can recommend that a student get or that a student has access to that would help their mental health need, and will, like Pooja was mentioning, will give them access to the education that they deserve. The other thing that PCPs can do is they can really monitor a student's progress. So in some PCP offices, you have the ability to have more frequent appointments. And so if you've developed or if you've identified one of these concerns and you've made a diagnosis, you could have a check-in with that student pretty regularly to see if the accommodations are in place, to see what's going on. And the thing that's really helpful about that is you get these time points where you can see if any developments or any changes have been made. Sometimes in the school setting, the school counselors and the school staff are really amazing about being hands-on and knowing what's going on, but they don't get to see the little time capsules, essentially. So they don't get to see the progress as much as you might. And so that's a huge contribution that you can make. The last piece is that you can connect this student to resources or providers in the community. So whether that be for therapy or whether that be support groups for the family or different things like that. I'll make a plug for CPAN here. This is a great way that you can utilize CPAN, because I know that the CPAN networks across the state are able to provide these type of resources. And so we wanted to actually talk a little bit, we're going to go into some case scenarios to talk through these recommendations, because I think that's probably the most fun way to learn about them. And so we're going to start with a kid who has depression. So he's a 16-year-old boy. He is presenting to his PCP for his yearly well check. In talking to you, he's telling you that he is sleeping about 15 hours a day, but is still feeling tired. He doesn't really get out of bed most of the day, even when he's logging into school, because he is doing virtual school right now. But he says that he can't really wake up. So he might wake up at some point during the day and log on, but he's not getting up in the mornings. He talks about having stomach aches in the morning and pretty late at night. He's eating only 2 meals a day. He discloses to you that he's failing several classes and that he's really, really not doing well in school. And you get the sense that it's really because he's not engaging. So he's not logging in, not turning in assignments. He also tells you that he's really irritable. So he's fighting with his younger siblings. He's not really engaging with anything at home either. So you as a PCP do a screener in your office. So you do the PHQ-9 and he's scoring 15 on that screener. And he has checked the box that he has had thoughts of hurting himself. So I'm going to pause there. And I know that we have a big audience here and I wish I could see everyone's faces, but I'm going to talk to you through the chat. So I'd love to hear what some folks would do in this situation. So if this kid is in your office right now for their annual well check, what are some of the next steps?
And if any of the audience members want to actually speak, then send a chat to me and then I can unmute you too.
So I guess some of the things that while people are thinking through what they might do. So, you know, this student's starting to tell you what's going on, but I'm wondering if in that any, okay, this is great. I see one. Just because he's having the thoughts means you need to clarify if he has a plan. So that's great. Ask more questions, get a little more information. It sounds like a lot of people are thinking that, which is great. Exactly. Like really clarify what's going on. Perfect. This is great. Yep. Talk about the suicidal ideation and get a sense of what's going on. And that kind of falls into the category of this kid is talking about what's going on and you really need to dig a little deeper to understand. Great. So if he's being bullied or using drugs, exactly. Understanding the context and the issues at home. Yeah, this is great. So I appreciate all the comments. Would anyone think about how he's doing at school? Safety plan. Yep. And continue care. Great. Awesome. Thank you all so much for those inputs. So those are 100% what you would do. And we'll get to the PCP's role in a bit, but we wanted to think about the school and start with kind of what some of the interventions are that you could recommend for this student in school.
So, like Nathan said, we're definitely going to talk about your role within the PCP office because all these things that you brought up are very, very important. But thinking kind of past that moment of that evaluation, making kind of the recommendations or just talking through these that can be beneficial for students in the similar situation. And for this guy in particular, trying to identifying a trusting relationship between the student and at least one adult in school. Oftentimes across the board for kids with mental health concerns, having somebody they can trust that they feel like they can check in on them is really helpful. Even in the virtual realm right now, it's important to have, it's harder to do, but very helpful just to kind of check in and make sure that they are coping in addition to any other supports that are in place, particularly within the school context. And then, as everybody mentioned, kind of developing, asking and assessing for the level of safety and imminent risk, but also having the safety plan that maybe is developed in the PCP office, sharing that with the schools, and the schools that in themselves will probably have their own safety plan. And what that looks like and how often they need to check in just to see how the student is doing. For this student in particular, trying to ensure opportunities for positive peer engagement, as that's something that, given his age and what is helpful to him. And then in the context of learning, so, oftentimes when kids are depressed, they have a harder time concentrating and paying attention. So just assessing, like, is there something from an educational aspect that could be helpful? Oftentimes providing notes or study guides kind of in place to help kind of supplement their ability to kind of keep up with classwork, and potentially allowing extension for assignments, again, because maybe the mental illness, like the depression, is getting in the way of that. So to help them feel less overwhelmed. Another recommendation that could be helpful is providing multiple methods of demonstrating knowledge. So not just written formats, but maybe verbal, or just kind of thinking about creative contexts, ways that can engage a student in learning. Again, especially if their depression is getting in the way of that process. And potentially, I know right now a lot of kids are doing virtual learning, but potentially preferential seating of where they're sitting in the classroom, and what does that mean for the student in terms of enhancing the way they can learn. At this age, for students, one of the things that you want to encourage them to do is to be able to talk with their school staff and their counselor about what they need to be successful, and kind of having some ideas, but also collaborating with them and giving them a voice in what can help them feel successful and feel supported in the school can be beneficial.
Great, thank you. And yeah, I think we had a few more suggestions around understanding if he has any additional problems, any learning disorders, which is a great thing that we can talk about. And then working with the school to get some extra time for him are all great accommodations.
And it's a really good point. I think when you think about students and when they have mental illness is not separate from learning challenges. And so really, and in the context, when you have depression, it can impair your concentration, but is there also an underlying learning disability happening? And so just kind of assessing for that and allowing for the schools to support that process further can be really helpful.
And specifically, what can you as a PCP do? And so you all kind of in the chat were alluding to this, but really first and foremost, the important part is to diagnose and treat the condition. So in this case, the child that we're talking about did meet criteria for depression, and so diagnosing that depression and then treating the depression. So since he had some suicidal thoughts, safety planning is of utmost importance, like you all were alluding to. So really getting a sense of the nature of the suicidality, if there's intent or plan, and then going the step further and really talking through a safety plan for that child. There are some kind of online fillable versions of safety plans, as well as some apps that the child can download that can help them put in their safety plan. One of the roles of a PCP is actually doing that safety plan, because I know a lot of you are already doing that in your office, but then sharing that with the parent and with the school specifically, because oftentimes we're really good about sharing it with the parent and making sure they understand kind of the nuances of that plan. But sharing it with the school is an added resource, because they are able to enforce it, and they're able to kind of make sure that they're all on the same page, and they have those coping skills built in and available for that child at school as well. Another part of the treatment is again looking into if therapy or medication is recommended, and doing that as you would in your usual practice, but making sure that as we're looking at these accommodations, we're obviously doing that as well. The other piece is addressing the symptoms, addressing the things that might be influencing mood as well. And so for this child, sleep, physical activity, and diet are all things that we're needing something to be addressed. And so talking about things like sleep hygiene, assessing if a sleep study is needed, potentially prescribing a sleep aid like melatonin, talking about behavioral activation and physical energy. So he's spending the entire day in bed. So providing some education around how that might be negatively affecting his mood. And then lastly is diet as well, and making sure that he's eating good meals and that he's eating pretty regularly. And then safety planning, we talked about that, but like I said, that's something that you can do and share with the school. And I think there was just a very good point about is reviewed if they're currently taking the meds and if they are working. And that's really helpful. Thank you. So the next case is a 13-year-old girl who presents to their PCP with stomach aches. So she's a sweet little girl, and she's telling you that she's been having stomach aches every single day. She has trouble falling asleep. She's actually doing really, really well in school. She's in physical school right now, so she's attending in person, but she's going to the nurse's office fairly often. The teachers have noticed some irritability, so she's a little snappy with them when they might ask her about an assignment or different things like that. That was not typical of her previously. Additionally, they're noticing that she freezes when she's called upon in class. So if they ask her to answer a question, she won't answer. she says that she's nervous in large groups, so during lunch and if they have any sort of assembly. And an anxiety screener was done. And so the score for this GAD-7, which was the screener, was 13, which is in the moderate range. So I would ask you guys what types of things you would think about and what you would do next. She could have recently started puberty. It's a very good point. Something to think about. Get her engaged in counseling. That's great. And I guess one thing to think about is the irritability is an interesting one in this. I'm wondering if you all see kind of irritability as a main concern for some of the kids that you're seeing. Great. So yes, motivating to see if there's sexual trauma. So thinking through, again, that broader picture of there's other things that are going on that are not the main thing that they're presenting. And so we'll talk about some of the things that can be done specifically for the student in school, and then we'll move on to the PCP role again.
So some of the ways to support this student in school could be, due to the heightened anxiety, allowing the student, accommodations could be allowing the student to take a break, to use some calming strategies. If the student finds writing or journaling helpful, giving that as an outlet and allowing some opportunity for that during the school day. Oftentimes, youth and teens will find music to be a very helpful coping strategy. And so that can be something that can be included in their plan and figuring out what's the best way to do that in the context of the classroom, right? If everybody's not allowed to do it, figuring out where's the space and place that student can go to listen to music or to use to calm down. And for the student, perhaps just having that extra energy or needing fidget items is a really common one that can help just in the moment during learning. Perhaps preferential placement in the environment. So this student seems to have some social anxiety, and so where she sits in the classroom, but really having that conversation and assessing more about what is it that's making you feel worried or nervous. Is it a student? Is it kind of where you're sitting? Is it a teacher? So learning more so that you can really tailor those accommodations and recommendations to support the student in feeling more comfortable in school. Anxiety generally, even when it's related to social aspects, can also then transition into academics, because when kids get anxious and if they avoid, then they might fall behind. And so helping them come up with ways, alternative ways of completing assignments, or just coming up with ways to collaborate on what's the best way to meet your academic demands. And maybe that means breaking down assignments or reducing assignments. And this is not a forever thing, just until they can get caught up. And so I think helping to make things feel more manageable, especially with kids with anxiety, is a really helpful accommodation, and coming up with a very distinct plan. Because again, this is not to help them. The hope is that once they get the additional support for their anxiety through therapy and meeting kind of those underlying needs of what's causing the anxiety, and it's better managed, then they can go back to maybe adjusting those accommodations and not needing those reduced assignments as much. If there is a social anxiety component like there is for this kid, oftentimes just asking the teachers, instead of just being called on spontaneously, teachers can give students a heads up. I'm going to ask you this question, so they can feel more prepared and in control, or know. Or teachers can know, maybe I don't call on you, but I ask questions in a different way to this student. So if it's virtual, instead of just calling on them verbally through the chat. And thinking about finally just transitions, cueing. So like for the student, large crowds really bother her. So thinking about, do you get to leave class a little early so you avoid that hallway time? And these accommodations, again, can be temporary supports to help the student feel more comfortable while they're getting overall treatment for their anxiety. But just thinking about how and what that can look like in the school setting. And these are just kind of examples for the student of things that could be implemented to support her.
And I think there's been some good suggestions in the chat too about things like calming jars or calming objects that a child can engage with at school as well. So I love that idea. And I think that, again, the folks that know them outside of school have a good sense of what might be helpful at school as well. And so working with the school to make sure that the child has access to those calming things is great. So coming back to what the PCP can do. So again, this diagnose and treat is really paramount. So understanding what the main driving factor is. And I think a lot of you were alluding to understanding what the backstory is too. So if there is some trauma, if there is something else that's feeding into this anxiety, the second piece is to really, and this is something that PCPs can do for the student and for the family, it's really providing psychoeducation about the physiological responses to anxiety. So really talking about that fight flight response, talking about how there are certain instances at school that are probably activating that for this child, and making it such that it's hard to manage their anxiety in a way that they maybe would be able to at home when they're feeling a little bit calmer or in other settings. We're really big advocates of teaching deep breathing and practicing with the patients, and that's something that a PCP can do really quickly in the office. I recommend that as part of in this collaboration with school, you can teach the parent how to do it as well. And the parent can then talk to the school about how, deep breathing is something that has worked for the student, and that's what they're gonna talk about. The reason we're focusing on deep breathing is it's very easy to do, and it's something that is like a quick intervention that schools can very quickly implement. So even if you're in the process of getting a 504 or getting an IEP for the student, but you want to help them immediately, there's certain things that you can do in your office that'll translate really well to the school. Additionally, working with families to reinforce the use of these coping skills. And so once this child gets into therapy or is meeting with the school counselor, they might start to learn some coping skills. It's important for the PCP to talk through how, or I guess provide some education about how the parents should coordinate with the school to know what those coping skills are. And so they can have the kid practice at home as well, because practice is most important in really honing these coping skills. And the PCP can help facilitate that as well. The last thing that's important for PCPs to know, but also for PCPs to let families and schools know, is that avoidance, essentially what we know about anxiety is avoidance is an amplifier. So if you avoid something, you're going to become a little more scared of it, and it's going to be a little bit harder to face that because it feels a little bit bigger. A great example of that is if you need to write, if you're riding a bike, if you do it every day, it's pretty simple. But if you haven't done it in a while, it's a little bit harder. If you haven't done it in many years, it gets harder and harder. But the more you just start doing it and doing it, the easier that it gets. And so it's important to talk through this, and we'll talk a little bit about school refusal, but it's important for PCPs to make sure that they're kind of towing that line of giving recommendations, but not also making sure that the recommendations don't let a student avoid a certain thing. And so one kind of nuanced way in the recommendations that we just talked about is this student was freezing when they were getting called upon in class. And so instead of saying, we're not going to call on this kid anymore, that would be an avoidance. Instead, we're saying we're going to give this kid ample notice, or a different way of having them present their knowledge. And so we're not letting them avoid it, but we're preparing them and helping them work through the anxiety of that situation.
And one other thing, it'll be hard in the PCP context to give like the specific examples of what that could look like in school. And so one of the tools, as Nathan was just saying, is providing that psychoeducation to the parent, because then the parent can then go and advocate for their child within the school context and really partner and understand the recommendations, perhaps that the school therapist is making too. So just kind of everybody joining all together, which can be really beneficial. In the chat, someone noted that they thought it was important for children to see the same doctor rather than to go back and forth, and just to have that consistency of the same provider. And I think that that's when that is possible. And if it is, I think especially for kids, just knowing or having that communication, right? If they aren't able to see the same provider, but just getting to know them and their needs and coming up with ways to highlight those can be really helpful for kids.
And so we talked about, I mentioned this briefly, but school refusal is something that that comes up a lot for PCPs and in the mental health field. So this is a 10-year-old girl who presents for a doctor's note to excuse her from school. So you find out that she's missed 5 weeks of school this semester. She initially it started where she was getting picked up early from school because of headaches. So she would call her mom, go to the nurse's office and say, I need to go home. And then she started saying, I'm not feeling well and I need to stay home. And so she would stay home the whole day. And now it has been 3 or 4 weeks and she has not been in school at all. The school is saying if she's going to continue to miss this much school, we need a doctor's note saying why she's not here and saying that she has a valid excuse to not be in school. The family also tells you that she's arguing with her parents when she's getting ready in the morning. So every morning they try to get her to go to school. It's a big argument, a big fight, and then she ends up not going. When you're talking with her, she says she's worried about interacting with other kids at school. She has been having trouble with some of the kids at school earlier this year. And that she spends most of her time in bed playing on her device. And so she's not logging into any sort of virtual school, but she's really just in her bed most of the day. So you do some screeners and you find that the JD7 score is 14 and the PHQ-9 is also actually 14. So those are both in moderate range for the screener for anxiety and for depression. And so I'll ask y'all again, in this case, so this kid's not going to school and it's been almost 5 weeks now. What could we think is going on and what can we do to help this kid kind of get back to school and get back to functioning at a level that would be appropriate for a 10-year-old? Think she's being bullied. Yep, exactly. Like thinking through what is going on at school that's making it that she doesn't want to engage. She might feel that a teacher's being unfair. Yeah. So there's something at school that is kind of prohibiting her from going and is making it a really intolerable place for her to be. In terms of diagnoses, just from what we have here, does anyone have an idea of what might be going on? Social anxiety disorder. Yeah. So she did comment that she doesn't like interacting with other students and her GAD-7 score is a little bit high. Having some issues, not being comfortable asking questions or struggling at school. Great. So self-esteem and worried about interacting with other students. And I love the idea of checking for any disabilities like dyslexia. One comment that I will make is they're in school there, and you all probably know this as PCPs and people who are around children a lot, there's different jumps in terms of academic demand at different levels. And so she's a 10-year-old, she might be in 5th grade. And that is a time where some learning disabilities do come out. And so dyslexia, she might have managed very well, but as the workload increased, it gets harder and harder when they're in, as they advance in grade level. So those are great suggestions. Thank you so much. So we'll talk a little bit about kind of what you do with a kid like this.
So I think that to everyone's comments, absolutely trying to figure out what is the underlying cause of this child and why she doesn't want to go to school. And as a provider and kind of thinking about school interventions, talking about a school reentry plan. So once you kind of figure out what is the underlying cause, how can you help that child get back to school in a way that feels comfortable and manageable? And we'll talk a little bit about, we'll have an example of what that could look like. But then also just going back to the relationship. So having somebody identified at school that the student feels like they can trust and check in and feels like they're in my corner is really important, especially for kids that don't want to go to school. To have some sort of incentive for school attendance, and that could be, spending time with friends at lunch. For younger kids, that could be one-on-one time with that adult that they've identified, or picking out of a treasure box, depending on the age. I think working with the school to have some sort of incentive and working with the parents to have something that is reasonable and makes sense, that is going to motivate them, because potentially there is some sort of underlying anxiety, or once we've addressed whatever the barrier or the stressor is, in case there's any bullying, addressing that, of course, but then addressing the mental health kind of need as well. I think probably most kids that are not feeling comfortable going to school and refusing to go to school don't feel like school is safe for whatever reason. And so kind of creating additional safe space in school, and finding that place that does give them comfort and helping them know that where it is and identifying it before they can go back. And then oftentimes, again, kind of with the anxiety case, they could be just overwhelmed with how much work they have to do, because when they've been not in school for so long, like this kid, work builds up and then you feel really overwhelmed and you don't know where to start. So coming up with alternative modes of how to do work to kind of meet their needs based on their learning needs, but also a catch-up plan of how is this going to be on dates manageable, Oftentimes we'll do like calendars or just kind of identify subject by subject, what is it you're missing? How can you plan out to do this? And that's something someone at the school can really work with the student to do, but just kind of helping create that paradigm that this is possible, this is manageable. It feels so big and so hard, but actually let's break it down. Let's do this. And helping check in with the student and see, now that we've talked about this plan, how does that feel to you? And then identifying, this was kind of mentioned with the bullying, identifying and addressing any interpersonal issues. So it might be as severe as like bullying, but it might be just feeling like they're treated unfair. Who are the people at school that are not making you feel comfortable? What is going on based on the student's perception, and really supporting them in addressing that and problem solving that to help them feel like they are comfortable returning back. This is an example of a school reentry plan that I recently did with a student, and could also fit our student case for a plan for entering class late. So this student and this girl, very similarly, they have that underlying anxiety that we saw. It might be, oh my gosh, people are going to think, what are they going to think of me when I'm not there? I can't be there. I have to be there on time. So if I'm late, I can't go at all. And then having the anxiety of avoidance. So kind of coming up with a very specific plan of how to get back, what happens if you are late, and how to get help on schoolwork. So kind of coming up with very concrete ways of addressing those things that are causing the student anxiety and stress. And it's just step-by-step delineating that can be really effective and helpful. Developing relationships with teachers. I won't go through all of this, but this was kind of a specific one that you can kind of look at and see. One of the most effective things that I've found helping kids kind of reenter back into school is having a gradual reentry. So if they're feeling really overwhelmed with full days, working with the school and talking to them about, is it possible that they could do half days, or kind of what feels manageable to get more confident and have those positive experiences, and then build upon that to continue to have more and more time at school. And again, having those supportive people and positive experiences can help then shift their experience overall.
And so the PCP's role in this is, again, diagnose and treat and understand the underlying cause. And so for school refusal, it could be a lot of different things. There could be some anxiety, there could be depression, there could be bullying, as we've touched upon. So getting a sense of really what that is. Partner with the patient to find the solution. So what can we change about school to make it better for you as a PCP and someone that this student has hopefully known for most of their life? You're in a unique position to really get at some of those kind of underlying things. This one is really important. Don't write a full exemption note. So don't just let the kid not go to school and say they have anxiety, they're not able to go to school anymore. It's really important to provide that note so they're able to engage in a reentry plan, but make sure that you're working with the school in writing that note to say they'll be able to attend half days, or they'll be able to attend whatever it is in keeping with that reentry plan. Providing psychoeducation about setting limits to return to school. So talking to families about what home should look like when the kid stays home, and that there is still some structure. And then again, how they're gonna return to school. And then again, these frequent appointments to provide accountability for this reentry plan. And so while we move to the next one, I'm a little mindful of the time. So I'm gonna go a little bit faster, but so this one is a 10-year-old boy who again is presenting for his well check. He is not sitting still in school. He's having some trouble with, he's often getting into trouble. He's not completing assignments, distracting other kids. He has trouble making friends, and he tested high for inattention and hyperactivity on a Vanderbilt scale. So maybe we'll just move into the interventions, Pooja.
So really common interventions for ADHD in schools are just, again, multiple modes of instruction for kids, extended time on assignments, providing reinforcement, positive reinforcement and feedback, especially when they're doing on-task behaviors, and helping them be organized, allowing for breaks to move around, and changes in environment to help increase focus. So that might be sitting in the front of the class, or if it is at home in virtual learning, figuring out in a room that has the least amount of distractions. Organizational tools can be really helpful. So providing homework folders and having someone at school that's kind of dedicated to supporting that child and student practice those things, and checking in with them to see if they're really implementing them. And then finally, just take a quiet place to take tests or be able to focus can be really helpful too. And these are not exhaustive, but very common accommodations for kids with ADHD.
So for the PCPs, it really is this diagnose and treat. And so making sure you're sending the school like a Vanderbilt or a SNAP, which are screeners that the teachers can fill out to give you that data about what's going on in the classroom. I won't go too much into this part, but making sure you're treating with medications, stimulants or non-stimulants as is indicated. And again, the behavioral strategies like parent management training are providing structure. And again, talking about the structure for the family with these kids, and then also the importance of physical activity for kids with ADHD, because they have all of this energy and they're ready to move. And the studies are pretty robust that movement, it helps them to function at their highest level. So I think this is our last case, but this is a little boy, a 5-year-old, who comes to his PCP's office because he's having difficult behaviors at school, and inattention at home. So, and the parents would like an evaluation for ADHD. So he's not sitting in his seat. He's walking around the classroom. He gets angry at teachers when they ask him to do tasks. He's disturbing other kids, as you can see in this picture. He's throwing things in the classroom, yelling and crying often at home, at school. And there's not a ton of behavioral concerns at home. And so what can we do for this kid in the classroom?
So helping the kid with a reinforcement chart or a reward system in class to kind of, again, help with those on-task positive behaviors that you would like to see. It's helpful to have, for these kids that maybe have some difficult behaviors, just having a place to calm down and reset. And that space can be in the classroom, and sometimes schools will pick them if they're in special education, and there might be a separate place, but a space that they can go to, allowing for choices within the limits and the context, and helping kind of really practice that. And then even sharing the school and the parents, like just talking about the communication of like what works at home. If you're not seeing this at home, and can schools implement some of those same things, and what's happening in school, can parents implement some of those same things? Creating that consistency can also be really helpful. Individual workspace can be helpful for kids to just not be able to touch and, be busybodies around other children. Sometimes just kind of having that confined space can help. Modifying academic demands and breaking down expectations. If there's any sort of learning needs within there, just making sure to assess for those and really check to see if there are other things that are kind of spurring these bigger outward behaviors. Allowing for breaks and movement. And also, I think for kids at all ages and all with all sorts of mental health concerns, and whether you have them or not, facilitating one-on-one positive peer interactions, especially though for these kids that are having behavioral difficulties with other students, so that they're not always known as the mean kid or the bad kid, or just kind of getting that reputation interpersonally, but allowing them to experience positive interactions and allowing other students to experience positive interactions with them can be really beneficial.
And for the PCP, for behavioral concerns, it's really, really important to identify the underlying cause. So seeing if there's any ADHD is definitely important. Screening for autism, spectrum disorders, or other developmental concerns, screening for learning disabilities. I think adjustment disorder was one of the potential diagnoses. Seeing if they're just adjusting to a new setting. This 5-year-old, it might be their first time in a classroom. So understanding if that's really influencing their behavior. Sleep disorders is another one that that you should think about, because that might affect how they're functioning during the day. The PCP can talk with families about incorporating structure and really reinforce this idea that whatever behavioral plan comes up, it should be reinforced at home and at school. And so both parties need to kind of be on the same page about it. So we just have a picture of a behavioral plan, and the point of this picture is really to enforce that it doesn't have to be anything fancy. It has to be some stickers and a piece of paper, because you can really write out kind of how. I know there's some really pretty ones online, but you don't need it. You just need a piece of paper and some stickers or something that the kid likes. So in summary, PCPs really play a large role in advocating for children's mental health, not only in the diagnosis and treatment of it, but really in participating by recommending these accommodations at school. And I would love to empower you all to in this letter that you write to the school, write some of these specific accommodations, because the school will really take those and work on them however they can. And again, providing that psychoeducation for what these disorders are and how they affect the child to the family and the school. So I think that is all. We wanted to open it up for any questions, and I appreciate all the interaction during the talk as well.
See, thank you so much. This is a great presentation, and I love the two photos. The photo of the ADHD kid. Oh my gosh, that was just the perfect photo. And then I loved your photo of the, it doesn't have to be fancy, a piece of paper and some stickers. It's so interesting how for kids, the cost of the incentive doesn't really have much to do with how much benefit you get from it. So that's pretty cool. All right, we have our first question. Monica Tent. Can you comment on ADHD coaching and biofeedback?
Yes, of course. So I know, so for ADHD coaching, it's a lot of executive functioning coaching. So really helping this child manage their executive functioning deficits and really put organizational structure in place to have that. That I think it can be really, really helpful. We know that the kind of gold standard and the first thing we think about for a child with ADHD is medications. But that being said, these other strategies like the ADHD coaching and the biofeedback as well can be really helpful. And what I would recommend is that you really think through the scenario with that child and their family and their situation. And so sometimes the child might be very young, like they might be 4 or 5. So starting a medication doesn't make sense. Similarly, their family might not want medications, or it might not be indicated just given the social situation of the family in terms of adherence to the medicine. I think in all of those situations, these other approaches can be really beneficial as well. I appreciate
I think it is so important, though, to realize how big the difference is between the efficacy of a behavioral treatment and a medication treatment, specifically in ADHD. Efficacy is approximately 90% for medication in ADHD. So if you have the right diagnosis, don't be afraid to try a medication. Don't be afraid, and let us help you if you're first starting, because the difference really is huge. But if, like she said, if it's a very young child, definitely don't want to start with that.
And I would also add, like, maybe, in addition to medication, then adding on the coach or doing the biofeedback. I think in combination, that's actually like the best approach often for many kids, is then giving them the strategies and they're able to implement them once they have the appropriate medication support.
And then as our patients grow into adults, I think the behavioral parts are extremely important. So it really opens up a lot of different job markets to them if they can learn strategies for keeping themselves on task. Some of the correlations with having ADHD can be pretty very serious conditions, and such as ADHD is correlated with homelessness. And if those people that ended up homeless, if they had better strategies for helping to keep themselves on track, they probably would get much farther in their life in terms of their occupation. So that's, in that sense, it's super important.
I think I saw a question from Tina, which I really appreciate your comments throughout the session as well, Tina. But if parents do not want to accept their child has a mental health disorder and do not want to follow through on any of the treatment suggestions, I love that question because I feel like us in this field, we run into that fairly often. I think a really important thing is kind of, in the context of this talk is really working with the school to present a united front to the parents about what's going on. And so if you are able, school counselors would love to hear from you as PCPs or mental health providers in the communities. And so if you reach out to them and say, you know what, I'm really struggling, I want them to follow through with this. Do you have any tactics or suggestions, or maybe we could talk to them together? What could we do to really help this family understand what we think is best for their child? I think that sometimes that can be helpful because there's a lot of people who know this kid and a lot of people who are trying to help this kid. The other part is, I think, understanding where the family is at and why they're not wanting to engage in it, or understanding what their stigma against mental health care is, or understanding really their cultural context and why it's hard for them to accept what's going on and what you're recommending.
Well, thank you so much for your wonderful presentation. And you all really look like you've been practicing this a lot because it was just so smooth. I need to learn tips from you guys. But thank you so much.
Thank you for letting us. This is great to be able to share. Thanks for the
Oh,
wonderful
yeah.
questions and participation.
We actually have one last question on the Q&A. Is it okay if we answer that?
Yeah, of
before we
course.
dismiss? Yes. So Tina is asking, many parents feel that a pill will fix the issue. Do you feel encouraging talk therapy?
Definitely. So I think that a lot of times people think about a pill as like a quick fix. And what we know is that even if we start a child on medication, it's not a quick fix. And what I like to say is it's taken many years to get to this situation. It might take a little bit of time for us to correct it and get back on track. I'll let Dr. Patel talk a little bit about the therapy piece as well.
Yeah, and sorry, I missed that. I was trying to find the question. Can we just say the efficacy of talk therapy?
So it was just some parents feel like, yeah, the pill will fix the issue, but do we encourage talk therapy as well?
Yeah, and I would piggyback on what Nithya just said. I think that the way I talk about it is that we're not born with strategies and skills of how to handle stress. We actually have to be taught, like we go to school to learn math and those kinds of things. So therapy can be this immense opportunity for kids to learn some skills, and they're going to face stress ongoing. So giving your kids a chance to just kind of build up those muscles and those strategies, it's not forever, but it can be really helpful. And medication is a great tool to help open up the opportunity, right, to learn these skills. And then after a while, you don't have to be on meds forever, oftentimes for many kids. But these strategies you learn, you can take with you lifelong. So I think that's kind of how I sell it to parents and I talk to them about it.
Yep. Okay, one more question.
Okay.
What is the average time frame a child will typically need to use medication for ADHD once it's prescribed? And how do they taper off of it?
So appreciate that question. I'll let Dr. Martin jump in as well. But as I see it, it's really, really hard to talk about an average time frame because it's so unique to every child and kind of what their circumstances. Mm-hmm. I think the way I describe it to parents is a little more of, we're going to know if this is working and we'll start to see some changes. And so we'll try it out and it's a little bit of trial and error to see if we're at a place where things are working. I do always talk about tapering off and when we might do that. And the way that I think about it for ADHD meds is there's certain situations where the environment and their context is changing, where they may be able to use, they essentially can kind of like harness their skills and their unique abilities. And so, for instance, like when a child is graduating high school and potentially going into the workforce or going to community college or college, they may be able to have more control of their schedule. So tapering then makes a lot of sense. Similarly, if a student is going from elementary school to middle school, where they're able to choose some classes that they like more, where they might engage more, or they have more extracurriculars that they're really interested in, those are opportunities to trial off the medication. But I think that what we know about ADHD is it is a lifelong way that this child's brain is formed. And so part of it is making sure that they're getting the medication support that they need and also learning the skills to help manage. And then once they are able to get out of school, essentially, and get into a context where they can harness their abilities, I think that they might be able to taper off as well. I don't know if you have anything to add to that.
No, I think that it's usually not middle school that we should taper them off.
Yeah, that's true. Yeah.
That's usually the period of time I find where the kids are on the highest dose. I usually continue to increase through the high school years, but middle school, that's usually when I get to the highest dose I'll ever use with that particular child. And sitting in school for the school year keeps getting longer and longer. It's at least an hour and a half longer than when I was in school, and I'm doing okay. But the school year keeps getting longer and longer, and PE is less. When I was in Kentucky, they had 1 hour of PE for each week. Now, luckily in Texas, they have an hour a day. So, but then of course with this homeschooling business, who knows what people are getting, but sitting down still for up to 8 hours a day is just not a natural thing for any kind of kid, but ADHD kids are the ones that are really going to have the hardest time. So, yeah. Okay, here's another one. For an IEP or 504, what diagnosis can be used for intervention? I thought the diagnosis ADD, ADHD, is needed for the Disabilities Act?
So most often it qualifies under the ADA, but it can actually be under both. It is dependent upon how much, if it impacts actual learning. So some kids do have ADHD, but they're able to manage it, or it doesn't impact their learning, and they don't need to change like the type of instruction, and they can still get the accommodations under both 504 and an IEP. So it just kind of makes sense to see what is the best fit and how much accommodations and support the child needs in the school.
Yeah, and I think for if it's more severe, it usually, you would want to push more for an IEP.
That's
but
right.
For ADHD, I almost always start with an 504 because it's quicker.
Yeah.
There are fewer people involved, right?
Yes. Yeah.
All right, I think that was the last question. Thank you, Dr. Cecilio, for that question.
That's a good one.
And thank you so much to our guest speakers, and thanks to my staff, Raul Gomez and Lori Ardondo, for helping us out with the technical part. Thanks for everybody. Thanks for coming.